It's time now for Morning Rounds, and joining us are CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. First up this week, a disturbing prediction from a legal settlement between the NFL and former players. John?
Vanita, at least 25% of retired players can expect to develop dementia, much more than the general population, and at a younger age. We looked at what's being done to help the players.
And there's my old coach, Reed Eubank.
In Dave Herman's den, the memories run wall to wall. Highlights of a decade-long career with the New York Jets.
Old memories, that's Michigan State.
Now 73, he played right tackle during the 1969 Super Bowl.
I was lined up against Big Bubba Smith, and so he was slapping me in the head off for 60 minutes. And I woke up after the game, I said, who won?
No, don't get confused.
Over the past 20 years, Herman's wife, Roma, noticed he was gradually developing problems with memory and thinking.
It's the loss of the special things that we've done in the past.
The memories together.
Mm-hmm.
This shows that the hippocampus is damaged on both sides.
Neurologist Dr. Sam Gandy of Mount Sinai Hospital in New York is one of Herman's doctors.
He thought he had Alzheimer's disease. The panel of us who saw him couldn't agree on his diagnosis, whether he had Alzheimer's disease or CTE.
CTE, or chronic traumatic encephalopathy, is a degenerative brain disease linked to repeated head injuries such as concussions. Abnormal tangles of a protein called tau help make the diagnosis, and until now, the only way to find them was at autopsy.
This shows
Dr. Gandy performed an experimental PET scan that can detect the tangles in living patients to try to determine if Herman had CTE. A different scan had ruled out Alzheimer's. Herman's scan was positive for those tau tangles. The diagnosis was CTE.
So that damage is caused by physical activity, or is it caused by just age?
In your situation, I think the best explanation is it's from the recurrent head injury.
We don't have a way to confirm the diagnosis during life until now. And we can now establish the true prevalence and how common this disease really is.
So why is it so important for doctors to know the difference between Alzheimer's and CTE?
Because there are a lot of different causes of dementia. So Alzheimer's is the most common. There are strokes, there's CTE, there's low B12, there's low thyroid. So they all have different causes. If they have different causes, there are probably different treatments. So you got to tell the difference between the two to figure out an effective treatment.
This isn't just an issue for pro players, Holly. It's also an issue more and more for college and high school players. What's being done to prevent dementia earlier?
You know, I think the most important thing that's being done is actually what we're doing right now, which is just talking about it and raising awareness of how frequent these injuries are in kids. You know, so for girls between the ages of 10 and 19, soccer causes the most concussions, and for boys it's football. And helmets don't really help. Helmets do prevent certain injuries, but not concussions. So the most important thing is to pull kids out of the sport for as many hours, days, weeks, or months as it takes for them to get better from their concussions.
Also this week, a new study about taking charge of your heart health. The Journal of the American College of Cardiology says 5 is the magic number. That's how many lifestyle changes it takes to reduce the risk of a heart attack by nearly 80%. Holly, what's new here?
Well, right. I'm certainly guilty of talking about lifestyle change ad nauseum, but maybe that's a good thing. Because what's new here is it shows exactly how impactful just a few lifestyle changes can be on preventing heart attacks. The researchers found that you could prevent 4 out of 5 heart attacks in men by just changing a few things. And the problem is, though, it's easier said than done.
Yeah.
Only 2% of us adhere to these perfect cardiovascular lifestyle, conditions.
So, John, what are the biggest things we can do? What makes the biggest impact?
No surprise, by far, smoking. You stop smoking, you drop your risk by 36%. Wow. And then there's diet, there's waste. We talk about the increasing importance of the fat there that seems to cause heart attacks. Moderate alcohol consumption, that's a little bit of a mixed bag because on the one hand it can protect against heart disease, on the other hand there are some other problems with it. And then exercise.
3 American soda giants say they are ready to help the country slim down. Coca-Cola, PepsiCo, and the Dr. Pepper Snapple Group have a plan to cut the number of calories we take in from sugary drinks by 20% over 11 years. That announcement came Tuesday at the Clinton Global Initiative in New York.
We're talking about average a couple of pounds a year across the board, but for some people you're talking about a much bigger impact.
The drink makers promise to decrease portion size, add nutrition labels, and add lower calorie options.
A new study finds skirt size matters if you want to reduce your risk of breast cancer. John, tell us about this study.
This is skirt size as a surrogate marker for belly fat. We talked about belly fat and the risk of heart attack, and it turns out that belly fat can also increase the risk of cancer, including postmenopausal breast cancer. So they looked at women 25 to postmenopause, and they found that for every one skirt size increase per 10 years, the risk of postmenopausal breast cancer increased by 33%. If it was 2 sizes, it was 77%. Wow.
What is the correlation there, though, between belly fat and breast cancer?
Right. It's not entirely clear, but we do know fat cells don't just sit there in the body and do nothing. They actually interact with other cells and affect hormones in the body. Belly fat, in particular, can boost levels of estrogen, which is a hormone that some breast cancers use as fuel. So that might be the link.
Finally this week, a Northwestern University study looked at adults who use smartphone apps to log their exercise habits. Those people drink the most alcohol on Thursday through Sundays, apparently rewarding themselves for breaking a sweat on those days. Experts think the connection could be that people face social encounters by heading to the gym.
Yeah, it's really interesting. They couldn't find out exactly why, but it might be that if you do go to the gym, you have more energy to socialize, and you also maybe bump into friends and say, let's go out for drinks.
I thought for sure it would be wine, but it was beer. Most people consume beer.
You have to worry about cause and effect there, right? Because just because they're linked doesn't mean one causes the other. Because if you had followed me over the last week, you would have figured out that there was a link between eating hot dogs and a grown man tearing up. Because I was at Yankee Stadium for Derek Jeter's last game.
You had to get this in.
I will confess, have to mention that game. What a game.
It was a great game. All right, Dr. John LaPook, Dr. Holly Phillips, thanks so much.